Hi there. Um, Oops, there's some kind of technical stuff going on. Give me just a moment. I lost one of the channels. Hmm. Uh-oh. All right, I'm not going to be able to figure it out. So we lost one of the channels. But welcome, welcome, welcome. Let me know who's here. And then we'll dive into what's new and coming up with Lipedema. It has been one amazing week. Um, and I'll get to the big news first. Well, first of all, who's here? Let me know who's here. Um, if you want, don't have to. Anyway, we just got an article in Time magazine. So let me back up and tell you what happened is a couple times a month I go to see Dr. Perry in New Jersey, which is a very long day. So it's a 4 to 5 hour drive each way. We actually made great timing, and it was 4 hours down to Saddle River, New Jersey. And so we got there early enough for me to sit in the waiting room 15, 20 minutes and check my email. So I'm checking my email, and there is a um, email that says it's someone from Time magazine who wants to interview me about lipedema. And I immediately said, oh, that can't be. That must be spam. And so what ended up happening is I looked and I did a search. Well, first of all, the name was familiar to me. I had read some of her work. She is the health and wellness editor for Time magazine. And so I was like, oh my goodness, this is real. So I responded, and she wanted to talk to me right away. Um, I mean, that day. So that was Wednesday. And so Wednesday afternoon, after my session with Perry, Dr. Perry, which was wonderful. Okay. Hi, Jenny. Hi, Sandy, Sandra, Time Magazine. Yeah, great. Oh my God. I'm going to put that because I just need to see it. It was amazing. I'm going to show you the article in a minute. Um, so that was Wednesday. And on Thursday, I got an email. I told her the medical textbook was coming out. And also, a lot. We had a wonderful interview for 45 minutes. And then the following day on Thursday, I got a link from her that the article was written and it was published online. So, what's happened, which is really interesting, is there's a singer and rapper named Doja Cat. I had never heard of her. I'm old. I don't listen to rap music. And so, anyway, apparently, she did a TikTok post about realizing that the way that she said it is that she had an epiphany that what was going on in her body was lipedema, that she could see it in her mother and aunts, and that she finally figured it out. And that was a couple days ago. Well, obviously, that motivated Time to put together an article. And I have to say, first of all, the journalist, her name is Angela Haupt. Haupt. I think that's how she says it, Haupt. Angela Haupt was wonderful. Absolutely wonderful. And the article is so well done. So anyway, I got the link to the article yesterday. So it's only, this whole thing has just gone woo, 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 real quick. And so I am going to show you the article. So give me a minute. I'm actually going to read some of it. The thing that I loved about the article is that she did her research. She has, she references a couple of plastic surgeons, a couple of doctors. Here it is. Doja Cat says she might have lipedema. Here's what to know about the condition. So this is Doja Cat. I have since looked her up online, obviously, to see, and I actually went to the TikTok video where she talks about having lipedema. Apparently, she had liposuction before this. So she had liposuction some time ago, not lipedema liposuction, but liposuction to reduce the volume in her legs and backside. Anyway, here it is. She says, I always thought it was cellulite. So here's information about lipedema. And what's wonderful about it is that it has the potential to raise awareness. So they do a good amount of referencing medical literature. This is medical literature here. Lipedema, a common though often unrecognized condition, talks about it there. And I'm going back here. Fat that doesn't behave like fat. Then they reference Dr. Amron at Roxbury Institute, who's a dermatological surgeon who's been doing lipedema reduction surgeries at least for the past 10 years. And here it is. No one knows exactly what causes lipedema. Hormones play a role. First identified in 1940 with a little background, and that half of all research papers on it have been published within the last 5 years, which is true. Lipedema Foundation, which has funded quite a bit of the research in those research papers. And it takes an average of 17 years for women to seek medical attention after first noticing symptoms, and an additional 10 years to receive a formal diagnosis. So we're talking from, most of us start noticing it in our early teen years, that we don't get a diagnosis sometimes. Well, I didn't get mine until I was in my 60s. Because, and that's in part because the condition is often confused with and mistaken for obesity. Dr. Carmody and I did a recording for the Nutrition Network. We're putting together a course on lipedema, all about the distinctions between obesity and lipedema and even lymphedema. Hollenbeck is somewhere, it says that he is the head of, let me see where it says it. I'm not sure, but of the American Surgical Association. A little bit of a story. Cassie Grosvenor, I think that's how she says it. She's, I think it's Living with Lipedema is her blog. And she talks a little bit here about being in pain and then doing what she can. This is amazing. Your skin hurts. It's not like a pain you can go take Tylenol for, she said. She's a project manager for Lipedema Foundation. She talks about having a small, in her case, she's just at an 8-pound chihuahua. Me, it's a 10-pound cat, actually, an 8.5 to 9-pound cat, depends on the day. Um, and she talks about the pain and oh, and then some of my interview where I share my experience of the pain. And I said to her, it's everything from feeling like shards of glass are going through you to a burning sensation or aching. Um, eh, and they put in, well, this is one of the things, and I actually say this in our workshops. Do you know when you cut yourself and it gets hot and swollen around the cut? Imagine that being chronic and inside your body, because that's what we deal with every day, that kind of inflammation. Um, even the lightest touch can trigger pain. Dr. Zamani is a Beverly Hills plastic surgeon, and she has lipedema and she treats it. So there's a number of some information about her. Physical pain is only part of lipedema's burden because the condition is often mistaken for weight gain. Many women spend years blaming themselves before they receive a diagnosis. They diet more intensely, exercise more, and then try again. When the affected areas don't change, the assumption from doctors, from loved ones, from ourselves is that we failed. Fat bias is internalized. I said, this is a quote from me. Everybody tells me it's me, that it's my fault. And we internalize that. Over time, I added, that leads to incredible shame. It's all of true. And I shared about someone that I know who recently drove from Florida, Pennsylvania to see a doctor, only to be dismissed by the doctor and being devastated. But that's only one example. I said to her, I cannot tell you the number of women who have texted me or called me hysterical, having gone to see their doctor and been dismissed or in some way. I mean, I said more when I was talking to her, but in some way, not really listened to. That pattern of dismissal, coupled with years of unexplained pain, can take a profound psychological toll. And Zamani, the doctor from the plastic surgeon, say that patients arrive not only physically uncomfortable, but emotionally exhausted. And she said it affects self-esteem. Some struggle with anxiety, depression, or disordered eating after years of trying to fix a body that wouldn't respond to traditional weight loss. God, don't we all know this? She also notes that many women unconsciously adapt in ways that make the condition less visible to others or even to themselves. I was talking to someone and she said, I only wear long skirts that cover everything. uh, why women adjust their wardrobes and learn to hide the areas that feel different. The condition can remain invisible, reinforcing a sense of isolation. Um, that's why simply getting a diagnosis can be validating. When patients finally understand what's happening, they feel heard and recognized, Dr. Zamani said. They feel empowered. Putting a name to symptoms reframes years of confusion, shifting the narrative from personal failure to medical reality. And then she talks about therapies that are multi-pronged. Surgery is not the end all and be all. I say that all the time. Then there's compression, manual lymphatic drainage, reformer, doing a rebounder, Pilates, water aerobics, the things that we know, the things that promote circulation and increase muscle strength. anti-inflammatory dietary approaches, which is low carb. Okay. Dozens of therapy, vibration plates. And so Cassie shared some of all that with the Angela. And then, of course, lipedema reduction surgery. Um, Many patients eventually consider surgical options, and that's true. But as we know, it can be very, very difficult to get insurance coverage. And Cassie shared that she had 5 surgeries and she did get it covered, but she had to work like crazy to get them covered. Okay, here it is. Yet access remains a major barrier. Despite growing recognition of lipedema as a medical condition, surgical treatment is often not covered by insurance. A lot of these patients are paying out of pocket, Hollenbeck says. He's the head of the American Surgical Association. Depending on the extent of the disease, costs can climb into the tens of thousands of dollars. Advocates and clinicians are pushing insurers to recognize lipedema surgery as medically necessary rather than cosmetic, a shift that they say is critical for patients who are debilitated by pain and mobility limitations. And so Cassie was fortunate. She's a project manager, so she says it's not easy, but she was able to do the work, months of documentation, appeals, being really persistent. And so, and then last year, the Lipedema Foundation did a session at OMA, the Obesity Medicine Association conference, and they had 1,000 healthcare professionals show up. Apparently, there's also a question about lipedema in the board examination for obesity medicine boards, which is amazing. That's recognition. And then our medical textbook is linked here. So our medical textbook, here it is. It's linked to the publisher. Lipedema, Principles and Practice of Diagnosis and Treatment. I'm gonna, and then she finishes up with saying that we've had hundreds of women now attend Lipedema Simplified, our organization's workshops and conferences each year. And I think she asked me what I'd want women to know. And I said, there's a growing community of patients and clinicians who understand this condition. You're not alone. And it's a message I hope will reach women who have spent years thinking that their pain was a personal failure. So I am incredibly grateful. Okay, here we are. Doja Cat. Do people know who she is? Well, I feel like she's been a blessing. And oh my God, Sandra says she's been asking for help for over 40 years. She was just diagnosed in December. So let me get the article link so I can put it in the chat and it'll stay with the recording because I think it's an important thing to have here. And yep, that's what they're saying, that's what it is. Okay, here it is. Uh-oh, an error occurred. Okay, it's on YouTube and it didn't get onto Facebook. I apologize. There's some kind of error. I'll go and put it on Facebook manually. So, it has been a busy week. I want to close by saying I am profoundly grateful. Profoundly grateful. It you know, I said to the journalist, when I started, it felt like I was in the Amazon forest with only a machete to try and, carve out a pathway. And now it feels like with this article coming out in Time and with Doja Cat um, posting about it, she got over 1 million likes on her post within 2 days, and that we're raising awareness one day at a time, one moment at a time, one step at a time. So I am profoundly, profoundly grateful. So with that, I'm going to say have a wonderful weekend, and we will be in touch sometime really soon. See you. Take care.